Hello and a very warm welcome to all of you. Thank you so much for joining us this morning, afternoon, or evening, depending on wherever you are in the world. I am so honored and excited to meet all of you. My name is Masi Juma, and for the next 2 days, I have the pleasure of being your host for this important global event, the Lives in the Balance Summit on the health and well-being of women, children, and adolescents. I am a journalist for BBC Africa, and I'm extremely passionate about community health, maternal health, and child health, and also sexual and reproductive health. Now, for the last few months, I have witnessed firsthand the ravages of COVID-19, the effects it's having on all of us. And I have witnessed the tireless efforts of the global healthcare community as it works to turn the tide of this pandemic. While all of us have been greatly affected, we cannot hide away from the fact that women, children, and adolescents bear the heaviest burden of such crisis, whether it is, in their really important role as primary caregivers, or even as they seek services in hospitals when pregnant, or at home, where there is an increased risk of depression and anxiety, physical and sexual violence, and unintended pregnancies. And thus, ladies and gentlemen, on behalf of our co hosts, the Partnership for Maternal, Newborn, and Child Health and CORE Group, I am thrilled to welcome everyone to this 2 day very special event. And thank you for joining us. This summit was put together in record speed. And, we want to thank all our partners who have helped us make it a reality. Our program over the next 2 days is based on three key elements, which will also be our power words and tag words: reflect, share, collaborate, and act. And it's an exciting program indeed. We will hear from and interact with global health leaders from around the world. Our hosts have lined up for us an impressive list of keynote speakers, high-level plenary sessions on topics related to the key COVID-19 themes, concurrent sessions. We have breakout rooms to allow a deep dive on specific topics related to each of the virtual summit's objectives. And once again, I will just repeat that over 2 days, we will, one, pause and reflect. We will look at the bigger picture and examine the past months and previous epidemics to be better prepared for the healthy recovery that the world needs. And two, share best practices based on successful approaches to the COVID-19 response. And three, collaborate and act together. Private sectors, media, frontline health workers, youth, and all other groups to strengthen community engagement, build partnerships, and support technical capacity to work together to advance the health and well-being of women, children, and adolescents. Once again, thank you so much for joining us. And with more than 1,500 people registered, it will be great to know where you are all joining us from. So for us to know that, please do remember to click your location on the world map that is in the polls section of the website. I also encourage you to join the conversation on social media. Our hashtag is hashtag lives in the balance, hashtag lives in the balance, hashtag COVID-19. We'd love for you to share your thoughts and ideas and help amplify our conversation. Again, the hashtag is Lives in the Balance Summit. You can also see that the plenary sessions are being translated to French and Spanish and are accessible for the deaf and hard of hearing. Now, without taking any more time, please join me as we start on our 2 day journey together by welcoming our first presenter, musical artist and peace ambassador, Nazim. Nazim is from the Gambia and has written a song with powerful lyrics and a hopeful message of hope in the time of COVID-19. Over to you, Nazim.
Hello, everyone. How are you guys doing? My name is Nazim, coming at you live from West Africa, the Gambia. And these are testing times for everyone. And as we learn to adapt to do things differently during this pandemic, this anthem is dedicated to every woman, children, and adolescents out there. And it's called COVID Ready. Let's get it done. COVID-19, oh, it is real. It is real. oh, it is real. People dying, oh, everywhere. People crying, oh, everywhere. People suffering, oh, everywhere. Our communities, doctors and nurses, yeah. Choice that you make now can decide the future. The things that you do now can make a difference. We don't want to suffer more. Don't want to struggle more. We don't want to suffer more. Living like this. We don't want to suffer more. Don't want to struggle more. We don't want to suffer, no, no, no. Living like this. Our communities must unite. Our leaders got to unite. We got to be ready. Let us make our steps ready. COVID ready. COVID ready. The choice that you make now can decide the future. The things that you do now can make a difference. We don't want to suffer more. Don't want to struggle more. We don't want to suffer more. Living like this. We don't want to suffer more. Don't want to struggle more. We don't want to suffer more. Living like this. Yes, we can. Together. One world. We will succeed and overcome. To all the doctors and all the nurses saying thank you. We will never forget you. To all the doctors and all the nurses saying thank you. We will never forget you. COVID-19, oh, it is real, but we are realer and we are stronger, and we will conquer. Thank you very much. Together we can. Thank you.
Wow, what beautiful music. Thank you so much, Nazim. And I don't think there is any better way to start our day. Now, I'd now like to introduce our keynote speaker, a man who has definitely been and still is at the very center of the fight against COVID-19, Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization. Dr. Tedros, thank you for joining us. The stage is yours.
Thank you, Mercy. And very nice to see you virtually. And thank you also to Nazim. I'm really glad to speak following his very, very beautiful song. And thank you for your support, Nazim, in this. As you rightly said, we're all in this together. Thank you. Excellencies, dear colleagues and friends, it's such a pleasure to be able to open this two-day summit on the impact of COVID-19 on women's, children's, and adolescents' health and well-being. My thanks to the Partnership for Maternal, Newborn, and Child Health and the CORE Group for organizing this very important initiative, and especially to the Right Honourable Helen Clark, the former Prime Minister of New Zealand, and also to Lisa Hilmi and Helga Fogstad, the director of the PMNCH. The COVID-19 response is an example of why we need multi-stakeholder platforms where health professionals, academia, youth, the UN donors, and civil society can all come together. This event speaks to the power of partnership and how we can work together to address this global threat. COVID-19 magnifies the inequalities and vulnerabilities that many women, children, and adolescents already face. Countries are reporting disruptions across health services, such as routine immunization, family planning, antenatal care, services for sick children, and management of malnutrition, to name but a few. In low and middle income countries, millions of babies are missing out on vital vaccinations against dangerous childhood diseases. According to data collected by WHO, UNICEF, Gavi, and the Sabin Vaccine Institute, provision of routine immunization services has been substantially disrupted in at least 68 countries, putting an estimated 80 million children under 1 at risk of diphtheria, measles, polio, and other potentially fatal diseases. Our surveys have found that about half of countries have disruptions to community, outpatient, and inpatient services. The pandemic has also highlighted structural inequities for people with underlying conditions, which, if not addressed, could result in diabetes and cardiovascular problems later in life. Some inequalities are magnified by the response itself. Low-income families may not be able to access critical services that have been shifted online, such as health services and schooling, nor will they be able to access private care and medicine supplies the way wealthier families can. So-called lockdowns are also affecting the provision of mental health services, which are especially important during this crisis. Basic nutrition too is being impacted. Many children that rely on school meals will now be missing out on lunch and sometimes breakfast as well. People with disabilities, about 15% of the world's population, will be especially vulnerable. Women and girls with disabilities in particular experience multiple and intersecting forms of discrimination and exclusion. Dear colleagues and friends, I will leave you with 3 areas that require our focus. First, we need to advocate for an intersectoral approach informed by rights-based and gender-responsive laws, policies, and services in our different responses to COVID-19. Second, we need to address the gaps in countries where routine data systems have collapsed, which hampers our ability to assess and respond to the impact of the pandemic on low-income families. Third, we must focus our attention on the most vulnerable populations, especially those in humanitarian situations, which are being overlooked in the response. In a few minutes, my sister and the PMNCH board chair, Helen Clark, will launch a very important advocacy framework. On behalf of WHO, I stand behind all partners, civil society, health professionals, the private sector, young people, and more in advancing the PMNCH call to action on COVID-19. Please join us in this urgent rallying call to leave no women, children, or adolescents behind our response to this pandemic. Only through our continued dedication, solidarity, and commitment working together will we overcome this global challenge. I look forward to hearing the outcome of the summit. I thank you.
Wow, Dr. Tedros, thank you very much. You have continually demonstrated what it takes to expand access to healthcare with limited resources. So thank you again for your leadership and commitment to the health and well-being of women, children, and adolescents. We are indeed very grateful for your time and for your sobering but quite encouraging words. Now, ladies and gentlemen, we would not be here today if these 2 phenomenal women and their esteemed organizations had not thought about how important it is for these conversations to happen. I am talking about our summit co-hosts, women who are leaders in their own organizations, and generally, allow me to use this term, badass women. Helga Fogstad of the Partnership for Maternal, Newborn and Child Health, PMNCH, and Lisa Helmy of the CORE Group. Ladies, your efforts are truly appreciated, and now the floor is all yours.
Thank you, Mercy, and thank you, Tedros. Greetings to all, everywhere in the world, across 120 countries. On behalf of the CORE Group and the Partnership for Maternal, Newborn, and Child Health, we are so excited that all 1,730 of you have chosen to be with us today. This meeting is all about partnering, what we can do together to get through the COVID-19 crisis. But even more importantly, we are here to plan our recovery, our future together, making sure it is brighter and better. We are over 1,000 partner organizations in PMNCH, the world's biggest alliance for women, children, and adolescent health and well-being. And we need everyone's voices, everyone's ideas, everyone's success stories, and everyone's commitment to do more and better moving forward. Lives are in balance. What do you think, Lisa?
Absolutely, Helga. All of us who are fighting every day for the health and the rights of women, children, and adolescents have never really faced such a steep challenge as this before. And here at CORE Group, a global consortium that champions community health and the proud leader of the PMNCH NGO constituency, we're doing it at a time when our own families, our friends have needed care. I'm especially proud to be a nurse, and I know how instrumental that doctors, the nurses, the midwives, frontline health workers, they've all been during this time. So a big thank you to all of you. We all have our own stories, no matter where we are, about COVID-19. And that is why, to make this summit truly meaningful, all of us will need to share what challenges we faced in the many discussions over the next 2 days. But let's not just focus on the challenges. Let's also share what are the creativity, the solutions, the adaptability that has been going on with the COVID-19 response. And let's focus on collaboration and action moving forward.
Thanks, Lisa. We are all in this together. Coming to the program, we have people joining from all corners of the world. We will hear from great speakers from across our 10 PMNCH constituencies. We will hear from governments, leaders sitting on the hot seat of this crisis, and we will hear from young people whose lives will be forever shaped by this pandemic. We will hear from the private sector, academics, donors, healthcare professionals, and the UN. We at PMNCH know that leadership and solidarity is the way out of this crisis. This is why PMNCH today, through our board chair, Helen Clark, will also be launching a call for action on COVID-19 to bring us together and to shout with one voice.
We are one voice in solidarity, without discrimination, and forever vigilant in the COVID-19 response. Dr. Tedros, I know how busy you are, so thank you so much today for being here. We're safer because of the WHO, and your leadership has really meant so much to all of us. And Helen Clark, thank you for your laser focus on women, children, and young people during the crisis. We're really looking forward to hearing from you and other leaders during the leadership dialogue later.
2020 is also the International Year of the Nurse and the Midwife. I am looking forward to hearing about the experiences of Narges, who has been a tireless champion as a midwife in Iran, facing devastating conditions in her country.
Well, you know, Helen, we are really excited that we will accomplish this together. So let's start the summit. It's past midnight for Helen in New Zealand, and for others, with more than 120 countries that are represented here today in the summit, it's breakfast time. So now it's my pleasure to hand over to David Roberts, Executive Director of The Difference. David will be facilitating this online summit for the next 2 days, and he's going to explain how it will all work. So thank you, David, and to all of your team who have really been doing so much in the past 6 weeks to get us ready. David, over to you.
Thank you so much. Boy, this is very exciting. Good evening, good afternoon. For me, I'm here in Santa Cruz, California. It's coming up on 5:30 a.m. My 12 and 14-year-olds are fast asleep, which is just how we like them. I have the fun job. I have the exciting job of keeping things moving and keeping things connected and explaining to you how this whole thing works. I would invite you to look around the website a little bit. Mercy mentioned that there's a poll. We have some polls and engagement, and down at the bottom, we have a world map, and we invite you to place yourself on that world map. I won't show it to you now, but we have amazing set of countries represented. We want to put a few more in there. But just looking at the registration of the session, we can pull up those statistics for you. This was, more than 1,700 participants registered, and people can join without registering. Please encourage your friends, your colleagues, folks you know. Come on, join the site. Just jump into livesintheballotsummit.org, and please join the dialogue for as much as you'd like. These numbers are still growing, and we're really excited to have everybody here. So I want to provide clarity on the process. Anytime in these 2 days, we have 2 5-hour programs, one today, one tomorrow. They run the same hours. Anytime you're confused, anytime you want to engage, just come to the website. That's the one place to go, livesintheballotsummit.org. You come here and you can always chat in if you have a question, if you want to know where to go, but all the links to where you need to go are in this website. 3 principles: choice, voice, and connection. We want to give you choice on what you go see. So we've set up a program with 40 plus presenters, speakers, entertainers, and we want to give you as much choice of what you engage with as possible. Voice, we have polling, we have the chat. We want to engage and hear your perspective, and I will I don't know if warn is the right word, but give you the opportunity and the invitation to literally share your voice. We have 1,700 people or so, but we would love to allow you in smaller teams to share what do you see from all around the globe. Like-minded people thinking about these issues. It would be a shame to just hear from these 40 people. We really want to hear from you as well. Choice, voice, and connection. Connection is the final one. This is an event in a longer process. And we hope that some of the connections, whether they're through WhatsApp, email, phone, LinkedIn, any way you can connect with each other ongoing, we would love to foster that. So choice, voice, and connection. We do have this translated in International Sign Language, the plenary sessions. We also have Spanish and French. You can just click under the live stream to find the Spanish and French. For those, you'll actually go into a Zoom room where we have translation. Again, this is live. We could have recorded all of this and just run it. And so anytime you've got live situation, entertainment, programming, you've got things that are unexpected. It could be that a dog walks by or a cat walks by, could be that there's some construction noise, could be that someone's feed goes out for a moment. We don't know. But part of the sort of authenticity and electricity, when we were planning this, we said, let's make it all live. Let's make it so that folks are here and together at this time. What could possibly go wrong anyway, right? Okay, I want to get into the work. I encourage you to use the chat. If you find yourself in YouTube, because we are running YouTube Live, if you find yourself in YouTube, remember the one thing, come back to livesintheballotsummit.org, because then you can engage in the chat and the poll with everyone else. So please type into the chat if you want to say where you are in the world, please do, or how you're feeling this afternoon, this evening, this morning, please do. But I would like to know something. Our organizer would love to know something. Why did you choose, think about this, why did you choose to join this summit? All of us had a choice to do lots of other stuff. So I care deeply about these issues, but don't work in this field. I work in the women's, children, adolescents health space, and I want to learn more. I was drawn to a specific presenter or topic. I was asked to be here. I'm not really sure. Or, hey guys, none of your business. That's good too. Or if you want to type an answer into chat, why did you choose to join this summit? We're really delighted to have such a diverse set of people, and we're really curious to know, why is everybody here? Okay, once we have those results, we will share those back with you. Okay. And another thing is that we've been doing in the background is doing some graphic facilitation. So one of the things that we will provide during this plenary sessions is graphic facilitation to bring to life some of what's going on. We've got Megan Kearney. She's in Chicago. You see a photo of her here. She's actually working on the iPad, taking the prescribed notes from Helga and Lisa and creating those into something that looks pretty wonderful. So that's sort of the behind the scenes. Megan is working right now to capture this real time. But all of these will be available. This is some of the things that we knew that Helga and Lisa were going to say, and she added to that this morning as she listened just moments ago, and then shot it to our team. Again, this is all happening very quickly, but we find that these visual images can be super powerful. We've got music, we've got art, we've got spoken language, we've got poetry. We've really got an amazing session for you. So we're glad you're here. Choice, voice, and connection. We really want you to engage as much as you can throughout these 2 days. We welcome you, and we're going to continue to move you along. So Mercy, I'm going to pass it back to you, and we'll continue with our program.
Wow, David, that website looks really amazing. Hats off to you and your team at The Difference. And just look at, that world map and, the number of people that you already have, 1,700 people representing at least 100 countries. That's fantastic. I cannot wait to hear what the reflections of all these people are. And please, I would encourage you to, really actively take part in these polls, because it is a sure way for us to put our voices out here. And the actors, the stakeholders, the decision makers, the policy makers are in this summit. They are watching the live stream, they are listening to us. And we are going to task them to, take action, collaborate, and act tomorrow, and reflect and share today. I now have the pleasure of introducing our next keynote speaker, Narges Shiragai, head of the Midwifery Association in Mazandaran province, Iran. Narges, thank you for joining us today, and for all you do in your work as a midwife, and for leading, these important discussions and associations. It is a challenging time indeed for all of you people, especially the frontline workers. And as a midwife, would you just please tell us, how has it been for you?
Hello, everybody. Thank you. Thank you, Mercy.
We can hear you fine, so you just go right along. We can hear you fine. We're tracking.
Hello. Okay. When I was 9, the Islamic Revolution happened, and 2 years later, a war started which replaced adolescents' worries with the fear of death. I had to adapt, learn, get stronger, and move forward. I was passionate about astrophysics and wanted to be an astronaut. I couldn't achieve my dream here. When I started studying midwifery, not as a choice, soon I realized that it can be the path I was looking for, a way to help women and girls like me to live a better life. Years passed by, and I became a midwife, and as a mother of 2 teenage girls, I decided to start sexual health education at schools and managed to organize other midwife members to speak at high schools. Many admired the idea and some didn't. So there was some obstinacy and resistance to the idea, which we have frequently encountered in society about many topics, such as vasectomy, menstruations, family planning, and sexual health. With the weapon of knowledge, I went to this fight. Our society's misconception of sexual health, of women's rights, and midwives' vital role in the society. I learned to be creative in getting my message out and I thought I created a successful path. But COVID-19 surprised me. Iran was the second country hit by COVID-19. Lack of sufficient and accurate information on transmission, protection methods, and COVID's effect on pregnant women and newborns made the situation worse. Women lost access to proper contraception and antenatal visits. Newborns were separated from their moms, and healthcare workers were facing challenging time themselves. There weren't enough personal protective equipment, didn't have mental health support, and by doing their job, they were putting their own families at risk. What I've learned over these 50 years of my life is that I can't wait for problems to be resolved. I created an online health task force on social media for Iranian women and families on 18 March, and more than 150 midwifery association members have volunteered. With the help of these fantastic midwives, we created 24/7 online consultancy for all around the country. We were able to do more than 15,000 online consultation in various areas of midwifery, from prevention of COVID-19 to pregnancy, lactation, sexual health, and etc. People were afraid to go to the pharmacy for emergency pills or condoms. We continued our effort and gave free consultation over the weekends and share educational material with families. There is still a lot we don't know about COVID-19, but we are fortunate that we can ask for help. We get our information and guidance from ICM, WHO, and Iran MOH. As a midwife and an educator, I really saw how much teamwork and leadership are crucial for midwifery associations to serve the women who need us the most. It wasn't an easy task to deal with the specific issues pregnant women facing regarding COVID-19, especially childbirth and postpartum. We didn't have all the answers, and we still don't. Yet midwives have been on the front line of COVID-19 in Iran. Iranian midwives screened more than 600,000 pregnant women. Many midwives were redeployed to non-maternity areas to care for patients with COVID or do public health screening, which put them at risk. 25 million screenings were done by 12,000 midwives in the country, and we lost 3 midwives. We were motivated by the leadership and guidance of the International Confederation of Midwives. They sent us PPE to us and also provided updated information. More than ever, I believe we need more educated, passionate, creative, and independent midwives, like the ones on our task force. Just as we did in Iran before COVID, when we fought successfully to bring sex education into our public schools. Midwives now are finding new ways to support women online in these frightening days of COVID-19. A revolution, a war, and a pandemic have proved to me that COVID-19 is a problem like thousands of others. So it is our attitude, and more importantly, our hope that can help us overcome them. We have to build a future when the next generation not only can learn from our mistakes, but also react with wisdom. Zoroaster said, "My battle is against darkness, but I do not wield a sword, I stalk a lie." Thank you very much, everybody.
Well, Nargis, thank you very much for that on-the-ground perspective. You know, we wish you and your colleagues strength and power as you do this very important work. And just to remind all of us, please, that we are allowed to take part in the poll that David just launched a few minutes ago. Please do let us know why you're here, why you're taking part in this, why is it important to you. So on the website, on the bottom right-hand side, there's the poll section. You will find all the details there, and we are waiting to see what you think and why you're here. Now, I have the pleasure of introducing the Right Honourable Helen Clark, Board Chair of PMNCH and former Prime Minister of New Zealand. But before this phenomenal woman comes on board, we will watch a short video. Then Helen will come up and give her keynote speech before inviting a group of esteemed panelists who I can't wait to hear from on her virtual sofa for a discussion entitled Lives in the Balance, Leadership, Action, Hope for a World in Crisis. Let's see what the video says.
COVID-19 is laying bare the gaps in the health system, exposing gender, racial, and class inequities everywhere.
This is not new. Around the world, women, adolescents, and families have long voiced what we need, what we want, what we deserve.
We want quality care, including respectful and dignified treatment, with means to redress wrongs.
We want clean health centers and schools with running water and toilets.
We want health workers, especially midwives and nurses, who are respected and supported so they are better placed to provide respect and support.
We want to feel safe, whether at home or in a hospital, with those who are meant to care for us.
We want equal protection and promotion of our rights, including sexual and reproductive rights, no matter who we are and what we represent.
We want essential information, supplies, and services for sexual and reproductive health, for maternal and newborn health, for child and adolescent health, within reach during an emergency and every day.
Our demands are not new, but perhaps the world is finally ready to truly listen,
to act, to invest in a way never seen before.
To let the voices of communities light the way out of this pandemic and into a more healthy, equitable, and prosperous world for all.
Greetings, everyone, from Auckland, New Zealand, and great to have so many hundreds of participants in this virtual summit from right around the world. So grateful to Dr. Tedros for his warm and very supportive words for the cause that we're all here to discuss, the health and well-being of women, children, and adolescents. And thank you also to Nargis from Iran for bringing that experience from the front line of delivery and the essential work of the midwife. Well, we all meet knowing that we're in the middle of a ghastly pandemic, another horrible milestone registered in the past few days of the first 500,000 deaths. And we know this is really the tip of the iceberg as to how the pandemic is affecting people around our world. It's a health crisis, it's a social crisis, and it's an economic crisis as well. And we're facing what could be, at worst, unless more global solidarity is mustered for the economies that are really struggling, another Great Depression. Now, the Great Depression was well before probably almost all of us who are participating were born. But what I know from the history books is that in parts of the world, including in my own country, it was a catalyst for creating the demand for and then the delivery of a new social contract between the state and citizens, the catalyst for establishing comprehensive social protection and universal health coverage. So my question is, when many years from now, people look back on the great pandemic of 2020, 2021, 2022, how will they remember what our response was? And I think that's up to all of us to think about and to start demanding a future that's better than the one that preceded the pandemic. And the pandemic has exposed all the vulnerabilities, all the inequities, so many issues about the way our societies are organized. So I would hope that the lessons out of the pandemic will be a catalyst for change. Change like this. Can we address the inequalities and inequities in our societies? Can we aim for a world with universal social protection, which offers a shield to individuals and families and communities against shocks? This isn't going to be the last pandemic. This is the 6th time in 17 years that the World Health Organization has declared a public health emergency of international concern. These pandemics will keep coming at us. My second hope is, could this be a turning point when every government on earth gets serious about achieving universal health coverage? We have to be relentless in our drive to achieve that. And let's begin there with scaling up our public health capacity and our primary health services, which are the closest to where people live and so important to health and well-being of women, children, and adolescents. And my third point is, could this be a watershed moment for truly inclusive debate and policy making? This summit is about solutions, but solutions have to start with hearing the voices and gathering and engaging the input of those who are going to be impacted by policy decisions. Isn't it a simple but profound idea to ask those who use health services what they most need from them? And so I hope we will be able to upend our decision-making processes so they are truly inclusive of all voices, and the voices of women, children, and adolescents have to be heard in that process. Now, already you've heard those words, a call to action. Our partnership for maternal, newborn, and child health has come together with a call for action, a 7-part one, and we're calling on all governments for urgent action to mitigate the devastating effects of the pandemic on the health and well-being of women, children, and adolescents. Dr. Tedros has already voiced his support for our call. So what's it about? We are calling for the protection of investments in sexual, reproductive, maternal, newborn, child and adolescent health services. These are essential services, not optional extras that go by the by during a pandemic. We are calling on governments to strengthen efforts to advance sexual and reproductive health and rights and gender equality. We are calling for quality, respectful, and dignified care. We are calling for better support and protection for our health workforce, notably for our midwives and nurses. We're calling for social protection nets for all. We're calling for functional, safe, and clean water and sanitation facilities. And we're calling for scaled up prevention of violence against women, children, and adolescents. It has spiked during the pandemic. So these are 7 demands, which are straightforward, and they reflect basic human rights, yet they remain unmet. And during these turbulent times, with systems and resources strained, they can easily get lost in the noise. So here we are today, in this defining moment, calling for leadership, action, and hope for a world in crisis. That's the theme of our panel, which I'm going to invite to join me now on what we're calling Helen's Virtual Sofa. We want a candid discussion about how geopolitics and leadership, or the lack of it, is shaping the COVID-19 response. We want to discuss what actions can and must be taken to shore up commitments for women's, children's, and adolescents' health. Before I launch into introducing our panel, I want to hear from all of you. What do you think is the biggest challenge for women's, children's, and adolescents' health during the COVID-19 pandemic. And you should, as I'm speaking now, be seeing appearing on your screens a list of options. Technical team, do we have our options up on the screen for our multiple choice poll?
And you can click into polls, and that will take you right down to an area of our website that was should be ready to go. So please click on the poll and share your thoughts.
So while people are doing that, how long will it take technical support for those results to come up? Here we are. We're starting. Well, it's giving us a pretty clear picture, isn't it? Lack of access to essential health services. My goodness, 63%. And that's where the rubber hits the road, isn't it? If you can't access the service when you need it, whatever that service is, that is so fundamental. So I think we're getting the picture. Keep responding, please, but that first option has established a commanding lead, which no other option is going to overtake at this point. So let us come back then to our panelists, and just at the headline level, from the government of Kerala state in India, we have KK Shailaja, who is Minister for Health and Social Justice and Women and Child Development. KK is turning on her video now. We have Gabriela Cuevas Barron, President of the Interparliamentary Union and a Member of Parliament from Mexico. Video coming on now. We have Mark Dybel, Co-Director of the Center for Global Health Practice and Impact at Georgetown University in Washington, D.C. Video coming on now. And finally, we have Dr. Joni Buer with us, who is a physician and interim board chair of Women in Global Health and founder of the Young Beninese Leaders Association. Welcome all. Now, first to KK Shailaja from Kerala, which I've always understood to be a very progressive state in India, state of 35 million people in the southern tip of the country. KK was formerly a secondary school science teacher. I'm told she was referred to as Shailaja teacher, and she has been heralded for her remarkable success at keeping COVID-19 at bay in Kerala. It's a great pleasure to welcome Minister Shailaja to the virtual sofa. So, Minister, as of last week, there were just 22 COVID-19 deaths in Kerala. Every one of the 22 is a tragedy, but we know the potential for it to have been so much worse. Tell us about the approach you've taken to preparing for and responding to this pandemic, and what were the key elements in shaping the response?
Thank you, ma'am. First of all, I want to express my sincere gratitude to World Health Organization to giving our state an opportunity to participate in this discussion. We are all fighting against the pandemic, coronavirus, and we are also, we have two aims, especially two aims. That first is to flatten the curve of the epidemic, and the next is to making the mortality rate below 1%. And we started our work from the beginning itself, even if our preparedness started when this kind of virus reported in Wuhan, China, this January itself. And our early preparedness helped us very much. We adopted three strategies, main strategies to tackle this problem. First is about the potential source of the infection. And our strategy to address this angle is tracing of the potential cases, that trace, quarantine, test, isolate, and treat. That is our strategy. From the beginning itself, we adopted that strategy to trace the potential virus. And we implemented in a successful manner, and aggressive tracing helped us to get all the potential cases under our surveillance. And we started action, and we give very good treatment, free treatment to all the positive cases without any discrimination of the status, or any discrimination of poor or rich. We are giving free treatment to all the positive cases. Our second major strategy is to decrease the amount of circulating virus in the society. That is to break the chain of transmission. We adopted a campaign called Break the Chain, and we adopted an acronym of SMS. Means S means soap or sanitizer, using soap and washing hands, etc. And M for mask, using mask when anyone want to go outside, they should wear mask. It is compulsory. And also the last S is for social distancing. We are insisting the society, we are educating the society to live with the virus, or to break the chain of the transmission. And that campaign, the organizations and the individual persons, they are in the leadership of the campaigning of the SMS or the break the chain, and that also give us a very good result. And the last one is the reverse quarantine, because we all know that the vulnerable part of the population, that is the old age people, and also the pregnant women, and the differently abled, and also children below 10 years, they are more vulnerable to this virus, and we want to keep them away from the affected people or carriers, virus carriers. That we are implementing here in a vigorous manner, or in a our strategy is that. And we are keeping this population above 65 or 70 years from the reach of this virus, and that is reverse quarantine, that we are implementing through several volunteers and other organizations in the society. We are implementing that in a good manner, and that is why we get reduced our local transmission more than anything. Our local transmission is less than 11%. That is a victory. And most of the positive cases here are the imported cases, means the person who returned back from abroad or from different parts of our country, from other states. And the local transmission is too less, that is below 10%. That is because of this strategy. First thing, the tracing and isolation or quarantining of these positive cases. And the second thing, that break the chain or the breaking the transmission rate. And also the third one, reverse quarantine. Through these three strategies, we are able to reduce the transmission rate below 11%. And also our mortality rate, case fatality rate, is below 1%, that is 0.6%. That's also a victory, we can say like that. And also our reproduction rate of this virus, the R0 rate, is 0.25%. We can keep these indices like this because of this enacting of these three strategies successfully. And it is with the help of the people throughout the population we are educating, and we are doing this in a decentralized manner with people's participation, etc. And we want to ensure the marginalized people who are vulnerable will not become disproportionately affected by the virus. For that, we are adopting so many measures, that some social welfare measures. Our Honorable Chief Minister declared a package of 20,000 crores even in the starting, and we are helping the poor women and poor families. We are supplying foods for them. We opened community kitchens, and we are serving cooked foods for the poor people, and so many measures like that for the vulnerable people here. And that is why we can stand in a safe stage. We cannot say that next day what will happen here. and we are looking eagerly whether any community spread is happening or not. Up to today, no community spread occur. We are adopting some cluster management strategy also. Anywhere a case we got unknown from unknown source, we are doing a cluster management strategy there. We are declaring that that place a containment zone, and we are locking down everything there and supplying for the poor in every essentialities and livelihoods we are supplying there. And that is the strategy. This decentralized and that scientifically democratic and also the socialistic manner we are doing this thing. We are planning and doing this thing, and that is the secret of the achievement of Kerala. We are continuing that. We are in anticipating more difficult things and doing for better future. We are preparing for better future, ma'am.
Well, thank you so much. What's come through is the very strong commitment to equity, the free treatment, focusing on the classic basic public health measures which do work. And we really congratulate you. We all know it's a long haul with this pandemic, and you're going to have to keep it up for quite some time, and the road will be bumpy, but congratulations on what has been achieved so far. I'm going to turn now to Mark Dybel. I introduced Mark with his role as the head of the Center for Global Health Practice and Impact at Georgetown in DC. Mark, of course, well known to me from his time as executive director of the Global Fund to fight AIDS, TB, and malaria. And prior to that, he led the US President's Emergency Plan for AIDS Relief, known to us commonly as PEPFAR. So if I can bring Mark in on screen, please, technical people. Mark, we're living through some pretty tumultuous times in international relations. And of course, all our participants would be aware that in May, the US announced that it would hold back its funding for WHO and has also proposed a very large cut to its contributions to PAHO, the Pan American Health Organization. You've worked both at the multilateral level in the past, and you've worked for US administrations in the past. What, Mark, could you tell us about what such moves mean for US leadership in global health, which has been so significant across so many areas?
Thanks, Helen. Nice to see you again. I'd like to begin by inviting the minister to come to the United States and help us with our response, which is pretty not so good. I think where we are now, it sounds a little bit to me like when the UK said they were going to pull out of the European Union, but still wanted to be a leader in Europe. And that's kind of the position the United States seems to be taking. Unfortunately, it's more than pulling out financially. They've announced that we will formally withdraw from WHO, not just financially, but at all completely, and cancel the executive agreement that makes the United States part of WHO. So that's incredibly disturbing, and I hope it never happens. But right now they're saying it's going to. It'd be devastating for many things, financially for WHO, but also to not have the United States at the table would be just a big mistake, and I hope one that never happens. There are very good people in the administration who want to stay engaged in global health. I would also point out that we also failed to participate in the CEPI fundraising event that many other people participated in, and many of us thought we should have. On the positive side, the administration did pledge $1.6 billion to Gavi, which is the first time that the US has made a significant pledge to Gavi. I think probably related to COVID and the potential for a vaccine. And they increased their global fund contribution. So there are mixed things within the administration itself. I would say Congress has been fantastic. Congress even when it was both houses were Republican, they consistently every year rejected administration requests to reduce global health and overall development funding by large amounts, and Congress restored virtually all of it. The Senate Foreign Relations Committee just had 2 hearings. I testified on it about how the U.S. needs to be more involved internationally, both with our bilateral programs, but also for COVID internationally. And so far, Congress has put $5 billion towards the international COVID response in a bipartisan way. And there's a consideration of $12 to $18 billion in the upcoming emergency plan. So the position on WHO is deeply unfortunate. And the deepest part of that is not just the money, but formally withdrawing. The good news is that the administration is putting some money into other areas, like, as I mentioned, Gavi, but really hats off to a bipartisan Congress that has consistently restored global health money almost all across the board. But there's no question the US position and its leadership is waning, and we need change there. And I hope the administration reverses and takes the strong leadership role that past administrations have had.
Thank you, Mark. And I can say as one who led a major UN agency that had long been very well supported by the United States, which was UNDP, it was incredible friends in Congress who kept the faith for global health leadership, often when things were a bit bumpy in administration. So let us hope those great advocates play the role again that you just alluded to. Now, I want to bring in Gabriela Cuevas Barron of Mexico, Member of Parliament and former Senator, as well as the current President of the Interparliamentary Union. And the IPU is the global organization of the world's parliaments, representing nearly 180 member parliaments. I once in my long parliamentary career went to an IPU assembly, so I have a little familiarity with its work going back a long time. Gabriela, the question I'd like to put to you is, we've observed in reactions to the pandemic around the world that some authoritarian leaders appear to have taken the approach of never waste a good crisis. And the pandemic has created opportunities for them to tighten their grip on power and further repress, if I could put it that way. What are you seeing from IPU as you survey the world through the bird's eye view you have of what's happening? And do you think that democracies are going to come out of this crisis weakened, or can they emerge stronger?
Thank you. Thank you very much, Helen, and thank you for remembering your past as a member of parliament and as a member of the Interparliamentary Union. Yes, democracy is in danger, and we cannot take democracy or even human rights and freedoms for granted. This pandemic is, yes, a crisis, and we have to say it in that way, but it's not only a health crisis. You were saying that is only the tip of the iceberg. We need to understand that after this pandemic, it is very likely that we are going to be struggling with our economies, and that means jobs and salaries. And we need also to understand that that is going to be reflected into public budgets. And in some cases, that is going to bring us also a political crisis. Not in all countries, but it will depend very much on the reaction, on the actions, on the decisions. One of the concerns that I have is not only into the political behavior of some heads of state or government. Yes, in some cases, we can see that there has been some authoritarian or highly restrictive responses to the pandemic. But every response has to be constitutional. has to be temporary, has to be proportional with this challenge. These measures, these restrictive measures, cannot stay in our societies. And I would like to go a little bit further, Helen. The technologies that are being implemented as a response to this COVID-19 pandemic could be also used later to monitor people's feeling and to have some kind of political control about how citizens are feeling regarding one or two other candidate or to a political speech. There was a very good article a couple of months ago with Noel Yuval Harari, precisely about how technology can be used instead of for preventing disease, for political control. I think that in this case, parliaments, parliamentarians are precisely a very important instrument. Parliaments are the very heart of democracy. It is in parliament where the different political expressions, political parties, political ideas are reflected. It is also in parliament where women and men are represented. We want more women, by the way, but at least we're having women in all parliaments. We need also to have more youth. We need all different ideologies represented. And in this way, once we have strong parliaments, we need also these parliaments to defend democracy, to defend our human rights, to defend our freedoms. We can see that in general, from a democratic perspective, there are four main challenges to the stability as a result of the global pandemic. One is to be very clear and to have in our map that there has been some nationalistic answers. And we need now, more than ever, multilateral and global and regional cooperation. There are also some trends in terms of limiting democratic participation and also having more centralized governments. In this regard, what we need is more, we were just hearing, more civil society, more local governments, more involvement. Of course, we need less surveillance. We need the governments to rule, to make good policies, to take good decisions, but not to control people's feelings or people's ideas politically. And of course, I think that one of the challenges that we are going to have after this pandemic is, of course, higher inequality. We have been struggling for equality, for inclusion, for bringing all people to the same opportunities. But yes, there is a huge risk that after the pandemic, the world is going to become more unequal, and we need to build it better.
Yes, and a terrifying thought, because it was rather unequal before the pandemic, and to think it can be worse is really quite frightening. Let me bring in now Dr. Joni Bua, a medical doctor, founder of Young Beninese Leaders Association and interim board chair of Women in Global Health. Joni, we know that young people are central to the discussion on leadership required for today and for the future. How have young people, in your opinion, and perhaps particularly young health workers, been able to step up during the COVID-19 response? Just come off mute now. Bottom left corner.
I think
just demute once more. Great.
Excellent. Great. Well, technology. So thank you for the question. I think it's the COVID pandemic is such a huge opportunity, for us to see how we can prioritize, health issues, but also highlight our commitment for health and realize that development is not just about, politics and economic, but it's also about social well-being. So to answer your question, adolescents and youth are disproportionately affected by the COVID-19 pandemic. More specifically, girls and women, those with chronic conditions, disability, those living in poor settings, in emergency settings, but also those who has limited access to coping mechanism. There are a couple of issues, including safety risk, like young people's safety is at risk now more than ever. Gender-based violence, unattended pregnancy are rising. access to reproductive health services are limited, and civic participation are disrupted. And as you probably know, the health sector is the largest employer for youth, and employment in this sector has risen faster for youth compared to any age group. So young people are also part of the solution as professionals. Young professionals or young health professionals like myself put their life at risk every day, being at the front line and providing emergency and essential health services. We've seen a couple of young professionals serving as innovators or entrepreneurs, contributing to design life-saving medical products, low-cost ventilators, and quality ventilators, for example. But we've also seen a lot of young professionals working at the intersection of knowledge dissemination and knowledge production, either by disseminating fact-based information or dispelling myths, providing accurate information about COVID-19, or simply diffusing scientific evidence. Young professionals and young advocates are also very vocal in ensuring that risk communication is shared and is known by citizens, but also that infection control effort and contact tracing, for example, young people are part of it. I know one of the speakers highlight digital divide and how we can use opportunity of the digital technology to communicate. And I've seen a lot of initiatives, not just in Benin, in the US, in Europe, or somewhere else in Africa, where young people use digital technology and platform to engage, to build trust between government and citizen, but also to enhance community cohesion. And the second aspect I want to highlight specifically about young women. We know that women represent over 70% of all healthcare and social workers, and women have played and continue to play a critical role in service delivery. There are a couple of organizations that are really highlighting, championing the role of women and young women, women in global health with its COVID 50-50, championing gender equality in the COVID response, and suggested 5 asks that we need to consider in global health security, from equal representation, safe and decent work, fair pay, gender responsive approach, but most importantly, well-funded organization. However, I think there are a couple of gaps in engaging young professionals and young leaders in national task force, global committees, for example. How many governments appointed young leaders and young professionals as part of the national task force? Even at continental and global level, we would love to see, young professional, medical doctor, researcher, or young leaders, being appointed globally as well to carry out and speak on behalf of, the entire generation. I've also seen great work done by young leaders from the PMNCH, adolescent and youth constituency, championing this work in a couple of areas, from technology to service delivery to contact tracing. And an African perspective, the African Women Leaders Network, Young Women Caucus, has been running a couple of consultations with other parties to make sure that young people's voices matter. So I think that there is a need to realize that, yes, young professionals are playing a critical role. They are part of the solutions. And as I said, from service delivery to risk communication to contact tracing or innovation.
Thank you very much, Joni. There's a question I really want to ask Mark Dybel, with his deep knowledge of health financing at a grand scale, and a very successful mobilizer of resources for the Global Fund. And I know you have to go any minute, Mark. What do you think global health financing should look like in a post-2030 world, including on how we can finance women, children, adolescents' health? And how do you think the COVID-19 legacy is going to play out on the ability to raise financing in this area?
2 great questions. I mean, I hope post-2030 we actually finally are doing what we committed to in 2001, first with the Monterey Consensus, then the Paris Declaration, Accra Accord, Busan, and that is to focus on country ownership and focus on supporting people in the countries and their leadership, and doing it in a coherent, coordinated way, something we still do not do, and makes it a mess for countries. And for that reason, women's, children's, adolescent health is separated from things like HIV, TB, malaria, and many other things that makes absolutely no sense. So I hope by 2030, we're actually more coherent, more coordinated in supporting countries, which we've been saying we would do for the last 20 years. I also hope we fulfill the MDG vision that we focus on human beings, which relates to what I just said, and understanding what a human being needs for their full development. Because the health of a woman and child is not, you can't separate from agriculture, you can't separate from education. Certainly education is one of the most important things for the health of women's, adolescents, and young people. So I hope we put this all together and understand a human being and development and see the important issues this group works on as central to that, but linked to it. That would mean possibly consolidation of some organizations, but certainly possibly forced integration in a way we're not seeing. And if we focus on a person and country ownership, I think we could get there. COVID-19, I think, has two big risks. One, a significant decrease in external financing because of the devastating economic consequences to the countries that have traditionally provided external resources. The second is a significant decrease in domestic resources for health of any kind, because the economies in most of the low and middle income countries are being devastated too. Certainly that's the case in Africa, but actually across the board. And so that risk is huge of a total decrease in resources available, both internationally and domestically. And then the second piece of the risk is that what resources are available could shift to pandemic response and away from the vision we just talked about, which is focusing on the health and development needs of an individual, a community, and a country, and country ownership. And so those two big risks of decreased resources and or shift in resources to pandemic response, I think are very real. The positive side of that is what you opened with, Helen, that perhaps this will make us all understand the centrality of health and development as something that is essential, and economic growth and health, of course, is linked to that, as essential for the world to move forward. And let's hope that this crisis is, as you just asked, and thank you for that great answer from the parliamentarian from Mexico. We can have bad things from crises, or we can have good things come out of crises. And if we look forward and hopefully and outward in an integrated way, let's hope that we take the positive route out of this crisis, not the negative route, but we should be conscious of the risks. And then when we are conscious of risks, you can respond to them, as you did all the time as a politician, prime minister, and running UNDP. So thank you for the question, and I hope we can all move forward together. If this group pushes all the people you know, and all the people you know, we'll have the coalition we need to win.
As you say, Mark, there are precedents for people really being able to make big gains post a crisis. I've instanced my own country, but many others too. Roosevelt's New Deal in the USA, response to the Great Depression. We think of World War II, and that was the catalyst for forming the United Nations, with a resolve not to have a world war again, which we have succeeded in. So out of the pandemic, we have a big focus on this area of the universal health coverage, the comprehensive social protection, and building resilience for the adverse events. I have a question around leadership I want to put to the health minister from Kerala before we finish. But just before we do that, we do have another poll for you. And it's a question which centers on leadership. So we're asking you, and I think a word cloud will emerge, using the chat function, can you type in what you think is the most important quality of a good leader, especially during such challenging times? Type in your word now. What would you most want to see from a good leader, especially during very tough times like us. And you're coming in action-oriented, solidarity, resilient, strong.
And you can click on, you can do it in chat, and then if you click on the poll button on the website will take you into being able to build this word cloud with us.
Empathy, persistent, honest, decisive, humility. My goodness, you're really nailing it here, all our participants, and what they would see as characterizing a strong leadership response. And that is really a fantastic lead in to what will have to be the last question for our panel, to the Minister from Kerala. It won't have gone without notice to you, Minister, that the leadership of many of the world's women leaders has been inspiring through this crisis. And we know that women's leadership has also been important for making gains more broadly for the health of women, children, and adolescents. Now, Kerala stands out in India for long-standing achievements in health and female literacy, and you yourself are contributing to that legacy of strong female leadership. Any thoughts on how we can sort of create the enabling environment for more women to come into the top leadership roles and really show what they can do for their communities? Off mute, please.
Thank you. And we all are afraid of that the inequality will increase due to the pandemic. This pandemic is deepening the pre-existing inequalities among women, among the society. And we have to tackle that problem also along with the pandemic issue. And talking about the leadership, we can see that in the decision-making bodies, women are invisible all over the world. Only very few women are coming to the decision-making bodies. We are doing something in Kerala on that issue also. And in our local self-government, we have more than 52% of the local self-governments are headed by women here. But in the legislature, state level legislative assembly, it is not about 10%. And in parliament, in our country's parliament also, it is almost 12%. That is the problem. Throughout the world, we can find this kind of thing. And we should enforce for, or we should struggle for getting more women in the decision-making bodies throughout the world. In Kerala, we are struggling hard because we want to have equality, and we have more than 92% literacy rate among women, and we have thousands of volunteers. We formed a self-help group called Kudumbasri among the village women, and more than 4 million women are working in the grassroots level for the empowerment of women and also for alleviation of poverty, etc. And we have accredited social health activists. More than 30,000 women were working in that part. And we have 70,000 women in integrated child development scheme, etc. Through these activities, we are trying to push women to the social sector and to get more empowerment among women. But I think we have to work hard after this pandemic season. In the future, I think the inequality will become more, or women will become more unequal among the society, because more than 60% of the working women are working in informal sector because of the closure of the companies and because of the closure of schools, etc. The burden on the women become double or increased a lot because women are throwing out from the working sector. Actually, now itself they are earning less and they are earning their savings are less. But due to this pandemic season, that problems become severe after this. We should address that problem also. On the other part, the working hour of the women is increasing, because they have to look after the elderly more hour because of the lockdown and other thing due to the pandemic. and they should have to address their children or look after their children for more hours. The working hour in the home is also increasing. I'm not elaborating. All the issues of the women are increasing. The violence against women, that is also domestic violence, etc. That also will increase because of the lockdown and these pandemic issues. And we should have to address that problem throughout the world. We have achieved something throughout the years. With my experience of a politician and also as a minister, we have achieved something, but that is also under threat due to pandemic season. The whole world, especially WHO, should try our best to have the achievements sustainable, and also to get more thing in the equality of women. We should have to work. Thank you, madam.
Thank you very much, Minister. We're a little over time, partly because of the late start with technical issues for the summit. So I think I'll have to wrap it up there, but lots to think about and reflect on from what our panelists have said. And let's hope it helps inform the sessions that you're going to continue to have on the summit. So that's all from me. Thanks, panelists. And I'm handing the floor back to David Roberts to introduce the Reflect Breakout presenters.
Thank you so much to that panel. Really, really great, great discussion. I was particularly intrigued to hear the part of my neck of the woods. I'm in California right now, and we're in a really scary zone right now in the States. And so thank you for including the whole global perspective. That was just wonderful, Helen. Thank you. I did, as we move into our next piece, we had asked you at the beginning, where are you dialing in from? Where are you joining us from? And we wanted to give you a sense that it truly is a global group, that we've got folks from all over, looks like pretty much every time zone. And it's really, really fun to see such a group, a diverse group here. We're going to move into the action, choice, voice, and connection. We're going to give you some choice next. We're going to hear from what we call fire starters. We'll hear from 4 different individuals who'll be leading breakouts that will be very engaging. They're going to do a very kind of rather succinct TED Talk, and then give you a chance to think about what's thought-provoking for you, and then give plenty of time for discussion in these breakouts. So I'd like to pull up the slide that shows what the 4 choices are, and we're going to invite you to go into one of these areas. So here are your 4 choices. There's evidence, setting, preparedness, and people. And we are going to now do what we call fire starters, which is when we hear 60 seconds from one of the presenters in this room who's going to share back what they're doing. So first, I'm going to ask these presenters to please turn on their audio and video and pop up for 60 seconds. Joy Long, if folks go to your area, what will they learn about? What will they talk about?
Thanks so much. This will be a fantastic session all about the Ds. We've been hearing that COVID is a disruptor. In the 110 days since this was declared a pandemic, we've had more than 500,000 deaths, more than 10 million cases. But we've also had a disruption in the science and the evidence, 26,000 published papers. It's a deluge of information, or some of it is also pseudoscience and confusing. And in the midst of that, what data do we have for women, children, and adolescents? How can we use this disruption and the data to protect services for women and children? What can we do? So we're looking forward to hearing your ideas, and particularly ideas for solutions. Come and join us, and we look forward to reflect and collaborate together. Evidence, session 1, all the Ds. Thank you.
Outstanding, Joy. Thank you so much for that fire starter. Next, Dr. Marlene Timmerman, what will folks hear about in yours?
Hi, greetings from Kenya. The global COVID pandemic affects people in many different ways, with the highest burden currently in older generation and in men. However, the COVID mitigation measures have a huge impact on the most poor and vulnerable populations, including refugees, displaced people, migrants, and those living in humanitarian setting and fragile situations. And amongst those, the most vulnerable are women, children, adolescents, and mainly adolescent girls and young people. So, very welcome to our session 2, that will address these issues, responses, partnership, and also highlight the importance of evidence and of data, local data and disaggregated data to better understand and react. And we want to hear the voices of the women and the girls. So welcome to session 2. Thank you.
That sounds terrific. Both very tempting. Ahmed Arale, what will we hear about in preparedness?
Jambo from Nairobi. Due to absence of proper preparedness or inadequate health services, this pandemic is a looming disaster unlikely to fracture vulnerable communities. Some already weakened by violence, conflict, where displacement, malnutrition, and outbreak of diseases are already widespread. We require a whole society approach in preparedness to protect women, children, adolescents' health, especially in fragile states. This approach should bring the community at the heart of this preparedness. From previous outbreak, we have learned that community-driven interventions have been effective in providing quick, large-scale response to tackle such a crisis. We have unique vulnerabilities and strength to prepare, protect, and build back. We invited you to a session in room 3 to discuss more on that. Thank you.
Oh, thank you very much. Dr. Aparajita Gogoi, what will folks hear about in people?
So greetings, everyone. I think you've heard a lot of speakers talk about how the COVID-19 response today needs to be much beyond just reacting or responding to a health crisis. In many parts of the world, this is gradually taking the shape of a humanitarian and economic crisis. It's leading to loss of livelihood, decline in health service uptake, suspension of rights in some cases, and really sadly, a resurgence in archaic gender norms. It has amplified prevailing inequities and power hierarchies across socioeconomic status, age, and geographic location. And nowhere is it more evident than in the impact that it is having in the lives of women, young people, and children. It has been predicted that we will have long-lasting impacts, especially for the world's most vulnerable population. So what do we need to do? I feel it's vital that we hear about the lived experiences of women, of children, and of young people. But it is also equally important that we identify actions to amplify and address these challenges. It's really important that we look at what is working. Therefore, I am inviting you to Group 4. Join us to discuss how we can support in building resilience. How do we amplify these voices to be included in the short and the long-term response to COVID-19? Look forward to seeing you all. Thank you.
Thank you. Thank you. So as participants, you can go down the website and you can click into one of these areas in which you are interested. Again, you have 4 choices. Please go, and when you get here, we are going to invite you to connect, to interact, to share what's thought-provoking to you, and to really learn and have a dialogue with folks. So again, you can scroll down, you can click into it, you're going to actually enter a Zoom room, and then we will come back here. The YouTube, the live stream, remember the single thing for this conference, anytime you want to come back into the summit, it's livesinthebalancesummit.org. This is the single place. So we will be back here in just under an hour. We'll spend a little bit of time in these breakouts, and then we're back here in plenary. So we'll see you back here. Enjoy your time. Thank you so much.
main plenary, I am sure you really enjoyed your time in the breakout Zoom groups. It's been so difficult to choose which group to join to because all the 4 groups seem to be discussing very, very rich content that is, really important for our discussion today and tomorrow. Once again, before we move on and before we ask David to just show us some engagement stats on what our breakout rooms look like, I just want to remind you about sharing on social media. Please remember that our hashtag is #LivesInTheBalance. Spread the word, tell people what you're talking about, and get as many people on board as possible because this is not a one-man show. All of us need to do this. So before I go on and before we move from reflect to share, David, maybe you could just give us what the stats are from the groups, the breakout groups?
Yeah, you bet. So welcome back. I know people are coming in at varying levels. We had hundreds of people joining these groups. All of the groups had a lot of interaction, a lot of dialogue. We're going to hear from each of them, but it was great to see so many folks in the reflect breakouts. As you come in, again, we sent people out and back into plenary. We are sending everybody back in, and I would love to hear from you using the poll, not the chat function. Remember, the place to come is always back to this website, livesinthebalancesummit.org. Use the polling function. So click on the poll. And the question is, what is the one word that describes your reaction to the breakout group you were just in? What is one word that describes your reaction? Wow. Action, inspiring, response needed. These are really fantastic. Refreshed. Great. Well, I will say something about refreshed. I was, when you do a virtual session, you get the sort of breaks and the refreshment at your own leisure. I was really looking forward to doing some gentle yoga, some breathing activities, and just some sort of self-care with David Ito, which is built into our agenda for tomorrow for a longer period of time. And I would encourage you again to go to the Lives in the Balance Summit.org website that you're on and look at the agenda and look at the detailed agenda. Tomorrow we have David Ito from David Ito Healing Back. He's going to do a half hour in plenary, and we would love to have you join. Unfortunately, we had a little bit of a late start and we pushed some stuff. We wanted to let those breakouts breathe. It's so important to let you folks share. So that will come tomorrow. Again, choice, voice, connection. We really want you to talk. We really want you to choose. We really want you to connect and be engaged in our session. Next, we're going to get what we call headlines. So we started this with fire starters, where we heard from each of the groups, just 60 quick seconds on what they would be sharing. Now we're going to get headlines. So this will be 2 minutes. We're going to go in the same sequence. It will be Joy, Marydale, Sophie, and Dr. Aparajita Gogoi will go last, and we'll hear from each of those groups for 2 minutes. So Joy Lawn, if you would come back in, unmute and turn your video on. Give us 2 minutes. What do you folks talk about in your breakout?
Thank you so much. We had a very dynamic group, considering it was meant to be the science and evidence people. We started with a poll, which was quite shocking because the science and evidence community of PMNCH knew the COVID deaths. 3/4 of people, maybe because they just heard it, knew it was 500,000 deaths. But less than 20% of our participants knew that there are 9 million deaths already every year for women, children, adolescents, newborns, and stillbirths. And people were particularly unfamiliar with the large number of stillbirths each year. So this is critical. If we in the community of women and children's health and adolescent health worldwide don't even know our own death numbers, we can't make the case to protect the most vulnerable. And then moving beyond death and admiring the problem and the disease focus, we spent a lot of time talking about the solutions. So the power of families and communities, of healthcare providers, the need for leadership at all levels. And in the fantastic plenary session earlier, Helen Clark led us on thinking about leaders, and maybe people were thinking about political leaders. But in fact, all of us have a role to play as leaders in protecting women and children, in learning what's happening, and in building better. If we're going to do better, we also need to make better data systems. We can't expect in the middle of a pandemic to improve gaps in data systems. So as we build back better for universal health coverage, we must have better responsive data systems that also allow us to disaggregate by gender, by disability, by urban, rural, by ethnic group, because otherwise we can't find out who's affected. And we recognize that a lot of the data that we have on women's and children's health is actually not data on reality. It's people's perceptions through surveys or modeling. So really critical that we use and improve the data that we have so that we can protect women, children, adolescents, and the most vulnerable. Thank you so much.
Thank you. That was wonderful. A wonderful 2 minutes, Joy, to just share back the importance of data. It sounds like when you did your poll, you learned a little something, which is that there's still a lot to learn and a lot to be communicated out. So deep gratitude for running that group. And I hope that folks were able to connect with one another and feel like they had a voice. So thank you, Joy. Really a pleasure. Mary Dale, let's hear from you. If you're able to go off of, turn on your video and your audio, and we'd love to hear 2 minutes from you for the settings group.
Thank you. Can you see me or hear me?
We got you loud and clear.
Fabulous. All right. So in our group, we also had a poll that was basically asking whether people agreed or disagreed that it was possible to ensure that we could continue to provide critical services for women, children, and adolescents during a pandemic in humanitarian and fragile settings. And we said, on a scale of 1 to 5, how much do you agree with that? And essentially, we landed on 3 to 4. And some of the reasons behind this was because outside of a pandemic situation, it's already very difficult to provide access to these services. So during a pandemic, and based on our knowledge from prior epidemics, we know that the focus tends to shift towards that disease itself at the cost of providing essential services to women, children, and girls. So I think the takeaway for us was that we need to take a public health, a more general public health approach to strengthen the services that we already have and ensure that we can continue those services in a safe way, in a way that's safe for our staff, our clients, our beneficiaries, and the communities in which we're all living and working, and specifically move women and girls from last to women and girls first in these settings. That's all from me.
Fantastic. And those of you who attended these breakouts, I would encourage you as you're listening to jot in any notes into the chat that folks may want to know about a takeaway that you may have had. These are all recorded, so you can go back. We've got a few hundred people tuned in. We expect many, many more to go back to these recordings and look at them, but it'll help people go back and know what to go see if you type in a couple of notes of your own of something you appreciated about these presentations. So thank you so much, Mary Dale. Next, we'll hear from room 3, preparedness. Sophie, if you could join us.
Great, thank you so much. So I think our headlines actually dovetail quite nicely with Mary Dale there. So we started by discussing how women should absolutely be at the centre of the COVID-19 response, not as an afterthought, as they have been with previous health emergencies where the gender issues are discussed afterwards. Women have to be at the centre because of their role as healthcare workers, care workers, the burden that they face at home, and also their vulnerabilities in terms of domestic abuse because of quarantine and lockdown issues, and also the long-term economic and political impact it's going to have on women as we move forward. And when we say women at the centre, we want women at the centre from preparedness, the response, and planning and recovery, the whole way through that cycle. We also focused quite a lot of our discussions around community involvement and community empowerment. As my colleague Ahmed quite succinctly pointed out, that communities often have the solutions to the problems that we're facing when responding to something like COVID-19. But this also created quite an interesting conversation of how that dovetails with women's participation within civil society. Civil society can never be top down. That doesn't work effectively. It's about going and engaging with what's happening on the ground. However, if you're wanting to empower communities, how do you do that in a way that does not create additional burden on women? If you want to engage young mothers, how do you do that? We know that COVID-19 and health emergencies creates burden upon women. So in engaging in community activity and activism, it's just something else that's taking up their time in a period when their time is shrunk. So we really want to think about how we can do this in a meaningful way. So those are our takeaways. Women have to be at the center of the response at these 3 different levels. And really, if you want community solutions in very complex humanitarian settings, go to the community because they're often there. This is nothing new. We've seen this from Ebola. We've seen this from the Zika. As soon as you actually engage communities and the ways in which they want to be engaged, you start to see results in responding to these pandemics. Thanks so much.
Fantastic report back. Thank you so much. Again, the points of the women being at the center of it and the engagement of the community is not new, but it's all the more important, and it's showing its face again in the COVID times. Thank you for that. Next, we'll hear from people. Group number 4. Share a little bit about what you talked about.
Well, thank you. I hope you can hear me.
We can hear you just fine.
Okay.
I can't see you yet, though.
My video is on. I'll just kind of carry on in the interest of time.
Sure. There you go.
Yeah. All right. So our group really talked about some of the need to hear from the people whose lives are being impacted the most. We talked about taking and listening to these voices and taking them to key decision makers in order to ensure that the COVID kind of rebuild and response plans must consider what we're hearing from the ground, and including the fact that data-driven rationalization of services are needed to ensure that the most vulnerable population is not left behind. We also talked about, how do we kind of bridge the digital divide. A lot of us, this meeting itself, we have shifted to a digital medium, but we have to be mindful of the fact that many people across the world do not really have access to kind of digital platforms, even to smartphones. So how do we bridge the digital divide to ensure inclusion of all population groups? How do we think of innovative tools to reach those who do not have access to connections? And we talked of some examples. The third big thing that we talked about was really how do we make the lives of young people better, help them deal better with the impact of the pandemic. We talked of safe spaces, we talked of protective services, we talked about how more investments can be made about, strengthening the services, popularizing the services, and really justice mechanisms to be invested and strengthened. And the last thing that we talked about was that, are there ways and means of taking the voices from the ground to the highest level? This is an opportune time, we feel, to really look at installing some functional mechanisms where the lived realities, where the self-articulated needs of citizens are not just routinely captured, but also used to design and monitor program and policies. Thank you.
Fantastic. Thank you so much. Again, really exciting dialogues. We were able, some of us on the planning team and facilitation team were able to pop into a couple of these. Some used polls, many used mini breakouts where folks were allowed to chat with each other and hopefully just, bringing up that dialogue. We've got, I wanted to pull up that word cloud one more time and just sort of reflect on for a moment before I pass to Mercy. Just let you look at these words again. Take a moment and just sort of breathe these in. There's a broad human experience here. I live in Santa Cruz, California. One of my heroes, the Reverend Deborah Johnson says, whenever humans are involved, there's mess and beauty everywhere. Whenever humans are involved, there's mess and beauty everywhere. And I'm seeing it here in this word cloud. So thank you again to those reflect. Part one was reflect, and I think we really got some great discussion going. So Mercy, I'll pass it to you for some thoughts.
Well, thank you much, David. And I think that all of you will agree with me that it is already such an impactful few hours. So a big thank you, like you say, to all the presenters and participants who engaged so deeply in the discussions and breakouts. And just a reminder that this Lives in the Balance Summit is framed in 3 themes: reflect, share, collaborate, and act. We spent the last few hours reflecting on the past months and lessons, learned from, this current epidemic and even previous epidemics, and listening to all the speakers and listening to reports that we are getting from the breakout sessions. It just makes me reflect on my own experiences. And I must admit that, it's been a few tough months for everybody, but mostly for women and children and adolescents in my country. I am in Kenya, and watching news and just being a news presenter or giving people news this past few weeks has been depressing. Right now, the biggest conversations that we are having is around child and teenage pregnancies during this pandemic. I have seen, these little girls, 10, 12, 14-year-olds that have been impregnated since schools were shut down close to 4 months ago. Literally children carrying children. And I'm not talking about just 9, 10, 15 girls. I'm talking about thousands. We're having shocking statistics. Some of them have conceived from their relatives, their dads, their uncles. Cases of sexual and physical violence are at an all-time high. And, I have seen a woman whose hands were chopped off by her husband over a domestic issue. And the sad bit is that this woman, she cannot run away, she cannot leave because the borders are closed, or because, she doesn't have the capacity to sue or go to the courts and just follow the correct procedures for this man to be arrested. And this is the same script we read on from the 2013-2015 Ebola epidemic, where quarantines and school closures left women and adolescent girls vulnerable to coercion, exploitation, and sexual abuse. So these past epidemics, and now the COVID-19 one, have led to the churning of information. We have all this information, and there is a lot of do's and don'ts. But like the breakout group say, we need to involve the people who are most affected. But now, how do we use and collect all this information and the accumulated knowledge? How do we learn from our past mistakes and challenges and not be doomed to repeat them? The track record is very mixed. However, we know that there are many examples of successful approaches to the COVID-19 response. And we are fortunate to have this next theme coming up now, the share session, where a number of presenters will address elements of knowledge sharing, lessons learned, experiences, best practices, and data collection. Our hope, sincerely, is that, that an outcome of this session is that we have a better understanding of best practices and ways communities and countries are responding to stop current infections, deaths, atrocities against women, children, and adolescents, limiting new infections, and all that. So as we just reflect again on what we have discussed and prepare to go into the next theme, the share part of our discussion, let's just watch this short video produced by the CORE Group, and then we can move to fire starters from here.
For the dreamer who sees great things, whose faith can't be suppressed. Women, children, those with disabilities, who have conquered many obstacles. For the warriors in scrubs, who are working to save lives. We can make it easy and this struggle busting.
Stay home, stay safe, stay strong. Wash your hands, sanitize, isolate. It's time to take responsibility. Play your part. Stay home, stay safe, stay strong. Wash your hands, sanitize, isolate. It's time to take responsibility. Play your part.
Let love be shared in these hard times. Share hope, laughter, and prayers. Be determined that we will come out of this better. This is a test of humanity. Tough times don't last, but tough people do. Yes, we can.
Yes, we
Yeah, we can beat this COVID-19 down.
Stay home, stay safe,
Stay,
strong.
stay,
Wash your
stay.
hands,
Yeah.
sanitize, isolate.
Stay strong.
It's time to take responsibility.
Play your part.
Stay
Yeah.
home, stay
Pray
safe, stay
for one
strong.
another.
Wash your hands,
Reach out
sanitize,
and call
isolate.
somebody.
Take responsibility. Play your part. Stay home,
Stay home and stay safe.
stay safe, stay strong.
Stay strong. We can beat this COVID-19 down.
Wonderful. Okay, thank you, Mercy, and thank you for that powerful video. It's an interesting time where, many of us have gone through trauma or grief or something difficult alone or in small communities, but now we're doing it as the entire globe all at once. And it's encouraging, honestly, to see the different experiences that folks are having, to get a chance to share those. I want to reflect back on the leadership dialogue that was shared earlier, and we're going to pull up the graphic that Megan made of this leadership dialogue. As you look through this, my eye is drawn to the left side of the screen down low, where it says food, clothes, and support, and this notion of equity, and how different folks' experiences are, and how during this time, many of those differences are really exacerbated, and the impacts of those differences are really felt. So we hope that this graphic, the visualizations, and some of the kind of different ways of thinking through this is useful to you. Please chat in any comments into the chat feature. Again, we recommend that you use the website, livesinthebalancesummit.org, for your comments, for your interaction. Please look around at the agenda, see what's coming. As Mercy said, we're moving from the reflect piece to the share piece. And in the share, we've got really exciting discussions that we're going to hear from in just a moment. A couple things I will call your attention to more broadly is that these share discussions, again, will be recorded. And later today, we will hear from some spoken word. And we will also get an optional chance to network more around specific areas that may be interesting to you. So at the end of this program, at the end of both days of the program, once we end the plenary session, we do encourage you to opt into networking groups. You can see those down the website. If you scroll down, you can see what those topics are. And it's really just simply a place to meet people from across the globe who are like-minded, who are thinking about same issues you are. So that's later in the session. Don't click in now. It's not open, but I just wanted to call your attention to those. So let's hear from the fire starters. We will start. These are the reflect topics. And if you see on your screen, we have continuity of services. We have coordinated response across actors and sectors. We have infodemic of information and the accountability for the hard to reach. So let's hear a couple words from each of these. Continuity of services, would you go first? Just unmute and share your video.
Good morning, good afternoon. I'm Annie Portella. I'd like to invite you to join me, social scientist at WHO, and Tapiwa Mukwashi, a senior manager, supply chain of Village Reach in room 1. Two very different angles on some important points on how we can maintain the provision of essential services in these times of crisis. The difficulties in providing and accessing essential services have been highlighted as one of the main unintended consequences. We'll share some ideas and then invite you to further discuss what you're doing to make sure essential PMNCH services are provided and reached. Evidence-informed information is available. How we work together, services, health workers, and communities to protect women, children, and adolescents will be our main points. Please join us.
I love it. Thank you so much, Annie. That's really terrific. Breakout room 2. Carla's going to share around coordination of response. Carla.
Thank you so much, and greetings from Mexico City, where our first case of COVID-19 was confirmed back at the end of February, just really at the time when we began to process the launch of a new sexual and reproductive health program at the Federal Ministry of Health. By then, a cumulus of learned lessons had been registered from other countries, and there was also a recently produced cumulus of estimates on the pandemic's impact, which gave us a lead on the cues of the urgent need to focus on ensuring the continuity of essential reproductive health services. So please join Amos, Anshu, and myself with diverse perspectives from government, civil society, and the United Nations in breakout room 2 for a discussion on coordinated multi-sectorial and multi-partner responses to COVID-19 as we work together for women, children, and adolescents, as well as the broader community. Thank you.
Thank you. And thank you for joining from Mexico City, Carla. It's really amazing to get these 40 people together, 40 plus people together. You just think of the cost, the energy, the impact on the environment. And as I'm seeing the screen and looking at all your faces, it's just wonderful. Room 3, infodemic of misinformation. Sounds topical, as all of these do. What would we learn there? Rosamund.
Hi, I'm Rosamund Lewis. I'm from the World Health Organization, and I will be joined by Jonathan from Translators Without Borders to discuss the infodemic. What is an infodemic? What does it mean for us? How do we handle all this misinformation, myths, conspiracy theories? And of course, we would like to hear some examples from your experience on the ground. And Jonathan will also be sharing examples from his experience in the field. And we will be providing you with some tips and some tools and some elements to move forward as we develop this fascinating field of infodemic management and infodemiology.
Excellent. Big words and very important words. Love it. Okay, room 4, accountability for the hard to reach.
Sorry about that. The video wouldn't click when I tried to click it. And that may be the story of accountability all the time. Everybody has great objectives and intentions. And when you look at the actual results, they turn out to be something else. Accountability is another one of those big words. But in this session in breakout room 4, Walter Flores from Guatemala and I'm speaking to you from Bangalore in India, will be trying to address three questions. Accountability for the hard to reach. Are they hard to reach? Or is it that we aren't trying hard enough? Some people say it's not really about that. It's that the health system is weak for everyone, and accountability for health is weak for everyone, hard to reach or not hard to reach. Is that the case? And would more resources for the health system solve the problems of the hard to reach, the poor and the marginalized? And finally, a big question that both Walter and I will try and address in different ways. Accountability often seems to come in after the fact, after someone has been abused, or after someone has died. What do we do about preventing? Can accountability systems actually work to prevent abuse, to prevent death and illness? And those are the questions from our different perspectives that we'll be addressing. Both Walter and I have experience working on the ground in poor areas of Guatemala and India, as well as with activism and advocacy in civil society at multiple levels. So welcome to Breakout Room 4.
Indeed. Sorry you had trouble with your video, but you were well worth the effort. I will invite those 4 fire starters to please log off of this and go jump into your Zoom room right now. For those of us on Plenary, earlier I had introduced a poll, but it was a little confusing on how to respond to it. So I'd like to launch a poll now, and the way to do it is don't do it in chat, but on the website, go to polls, and it's a poll about why you decided to join this summit. What is it that brought you here? I care deeply about these issues, but I don't work in this field. Number 2 is folks who do work in this field. I was drawn to a specific presenter or topic. Was asked to be here. Okay, a couple people typing answers into chat. So why did you choose to join the summit? Click on the poll and then select one of these. Do you work in this space? Is it none of our business, or you're not sure why you joined? Did someone tell you to come here? I'm really interested to know, of the top 2, how many of the folks do work in the field? This is what you wake up every day thinking about because it's your profession, versus those who don't work in the field, but we care deeply and we really want to be connected, especially now, on how we can think about it more deeply. Okay. Okay, and if your answer was number 3, I was drawn to a specific presenter or topic, I would encourage you to share the agenda. And if you go to the agenda page on our website, there's tons of information, very specific about what is when. You have choice, you have voice, and you have connection. So we invite you to share the agenda, let folks know what is exciting, what they should come for, what they might be really interested in learning about. If you have any questions, you can always chat it into the website. We are monitoring the chat, and let's keep the dialogue going. So you have 4 different options to go see right now. Again, it's continuity of services in room 1, coordinated response in room 2, infodemic of misinformation in 3, and accountability for the hard to reach in 4. It'll be the same thing. You'll go into that Zoom room. Please enjoy the conversation and the dialogue, and we will see you back here in Plenary after. Thank you very much, and enjoy this next piece. Welcome back. Welcome back to Plenary. Hope those breakouts were good. It's 9:04 here, Santa Cruz time. My 14-year-old son, Finley, is up and making breakfast, and my dog is walking around, and it's a really different world that we live in. Some of those dialogues that we just had were really amazing. These leaders, presenters who spent their time with us, deep, deep gratitude. I wanted to pull up on the screen something that we've been doing behind the scenes, and I want presenters to know that you'll have access to all of this. Everybody will have access to all of this. This is the report back that we had, the dialogue from the Reflect groups. So this is just a visual capture of some of what we heard from evidence preparedness settings and people just in this room. And again, all of it is recorded as well. But I wanted to show you that you had that from Reflect. But this is Share, and we want to hear from the Share headliners. Again, it's going to be 2 minutes a person. We just love to hear. You went in with one set of expectations about what that dialogue would be, and maybe that was what it was, and maybe it was something different. So we would love to just hear how'd it go? What happened? We're going to start with Tapiwa. So if you'd please come on up on screen and let us know what you did.
Thanks, David. Our group had a pretty exciting discussion. Some of the key topical things that came out of the group were around engagement. Just what do we do to better engage with communities? And there was pretty good discussions around this. Linked to this was the discussions around what organizations are doing currently to be able to train and equip community health workers in the field. We heard about how digital tools are being used to relay the message, to train community health workers to be more effective. We had discussions around supply chain resilience. What do we do to make sure that community health workers and community health infrastructure, for example, clinics, continue to receive PPE in these difficult times with lockdowns and closures of borders? We heard about how supply chains need to reflect and convert from being global to more local. We need to strengthen local manufacturers to be able to provide when the global infrastructure fails. We heard about how it is important to keep motivating community health workers. We cannot continue to treat them as volunteers and expect them to provide optimal productivity. So motivating them and incentivizing them was a key point of discussion. We lastly talked about just how do we integrate community health projects so that they receive sustainable resupply and that they are linked to the community health public health supply chain infrastructure. So what do we need to do? We had interesting discussions that identified the key infrastructure, the key stakeholders that provide the key entry points for community health stakeholders to start involving themselves in planning and advocating for the inclusion of community health needs into the routine supply chain. So a pretty lively group that provided insightful reflections to help people improve in how they operate in the different contexts.
Great. Thank you very much. Thank you for group one. I will also just share that we've got about a little over 20 minutes of programming here. Please don't leave because we've got spoken word coming at the end of this that you're really not going to want to miss. Additionally, once we hear from the other three groups, we're going to invite you to do some optional networking with folks who may have the same interest as you. But the continuity of services at Group One is a really big deal. And I know in talking with some of the vaccination folks, we're heading back in time maybe, and we're losing ground in some areas, and it's very scary. We don't know where that's going to be. So a lot of unknowns there, but clearly it's extremely important. Let's hear from Group Two, coordinated response. Amos.
Thank you. Thanks, David. From Group Two, we had a very lively discussion, and I think the mixture of experts really gave us an opportunity to learn more from others. We heard how telemedicine is being used in Mexico and how there's there's a joint establishment between the different stakeholders with the different ministries that are pushing for the response. And then we also heard from how civil society guided in provision of establishment of guidelines to ensure that essential services actually continue during this period of time. And then we also heard how WHO is ensuring that they are able to receive examples, case studies from different countries on how they're handling the COVID-19 and how research is actually helping so that they're able to share with the other countries and the other partners as well. What was also very important from the group is that we learned how best we could actually do alignment of all stakeholders in finding key solutions at national level. How are they working together and how is this being done? Now, just before we ended, we also learned what we want to see. And our vision is that we want to see continuity of this multi-sectoral engagement amongst all these key stakeholders that have come together after the end of COVID-19, that we continue working together, we develop a plan where we can all do development work together, and then hopefully we can have a better world because we have seen that this is working during this period. Thanks a lot.
Thank you, Amos. And I love the forward looking and the optimism of how do you take what's good about this and move it into, okay, we all collaborated here. Let's continue that. Let's collaborate beyond. And some of those, yeah, a lot of the same actors. Thank you so much. Really appreciated it. Breakout room 3. Let's hear from about the infodemic of misinformation. Jonathan.
Okay, well, yeah, so during the breakout, it was all the comments went through the engagement. They said there should be engagement on all the level. First of all, on the political level, on engagement with the community, the civil community, with the engagement of all parties, so that together we can exchange ideas and see how to combat the COVID-19. Yeah, we also discuss, we give some issues, some ideas of how we can include such people or such a person who can have the access, the direct access to give the message to population. First of all, we spoke about the musician and we saw it, the media, and we show that even in the rural society where we don't have, where we have people with lower literacy rates, so that children can be at some point with higher literacy rates, and they can even help their parents or help the caregivers with information, and that we say that all our action should be, we should ensure that we tailored children communication so that they can understand and share content. So that was the discussion, and everybody, so we talk, we have the same point, so that this should be an engagement. So everybody should get involved in that. So even the point of wearing masks, so that we have seen, for example, in DR Congo, where people are wearing masks without even know how to wear a mask. So they just take a mask, they put, and they go. And you can see the same person today with the same mask, tomorrow with the same mask. And I think the information should be from the government. They should clarify all those elements from the organization, humanitarian organization, from the community, so everyone can see and understand that the engagement, we all to have engaged in this process of combating COVID-19.
Great. Thank you very much, Jonathan. Okay. So we'll hear from our last discussion, accountability for the hard to reach. after that, Mercy will pick it up with some summary of what we've heard in this. So Walter.
Yes, so in our group, we started discussing about the new context, the new reality that we are observing as a result of COVID-19. And the first main issue, the new reality, is that we have a much higher number of population in situation of vulnerability, either because they have been directly affected by the virus or they have been negatively affected by the government measures of lockdown and others to try to control the virus. The second aspect that we discuss is that the majority of countries around the world have failed in several fronts. The first one is to be prepared for the virus. All over the country, even if it's a poor or rich country, we have seen failures in terms of resources for frontline providers, in terms of adequate information for the population. We have seen that there's major gaps in explaining in a clear way what is the virus and how to protect yourself and your community, and also a lot of problems with honest and transparent information to people. So the result of this failing, it has been the breakout of trust between people, citizens, and their governments. And this is very serious because social accountability to be effective requires a basic level of trust, trust in authorities, trust in elected officials, but trust also on norms, rules, regulations, and institutions. If we do not have that, social accountability cannot work. After that, we discuss that, fortunately for us, social accountability can help us in this new challenge, but only if we return to the basic of social accountability. Social accountability started 15, 20 years ago, not as a collection of tools, as is usually understood nowadays. Social accountability started as a process of building relationship among different stakeholders, a process that will facilitate trust among healthcare providers, but also among women that were very much afraid to come to a healthcare facility. So that's how social accountability started. It became very popular just to concentrate on tools and the scorecards, but the basic, the core of social accountability is building trust. And this is very important because trust cannot be achieved by decree. No government or no national level policy can order us to trust each other. Trust needs to be rebuilt. And that's why we think that this is a very important opportunity for social accountability processes. And also we need to be aware the implication that it has for implementing organization, for academia, for funders, for civil society, that in this rebuilding of trust, we need to support local organic processes. We need to be aware that this is going to take time. We should not be thinking about magic bullets to regain trust, but support many of these efforts at the local level. And we stop there.
Wow, Walter, thank you very much to you and to all of the share reporters. I think we have very, very insightful words and very, very insightful outcomes from what you guys have heard in the breakout sessions. And I'm really amazed by all this information being shared in here. This surely should be a guide in churning out a better response, for our women, adolescents, and children. And it's just amazing that, all the 4 of our reporters were men. Just clearly shows that the He for She campaign is really doing a good job out there. And we are so glad that you are advocating for, the well-being and the good health of women, children, and adolescents. Once again, it was very hard to choose which breakout room to go out to, but I am happy that, I'm not missing out on anything because all the plenary sessions and all breakouts are recorded. So all of us can definitely go back and watch out. And we're talking about inclusivity and ensuring that in our decision-making in every step we take, we include all the necessary people from the women, the children, and the adolescents. And this summit and the co-hosts are just showing us that even from right here, that's what they're doing. And it gives me incredible pleasure to introduce this young lady her name is Jamoni Benson. and she is a 15-year-old up-and-coming poet from the southeast area of Washington, D.C. She attends Skip College, and yeah, like I've said, she performs poetry and loves being active. She is a rising junior, and through her poetry, she likes to spread positivity and give her listeners something to think about and take into the world themselves. Hi, Jamoni, welcome, and thank you so much for joining us.
Hello, I'm Germani. I'm a 15-year-old poet. I like to spread positivity through my poetry, and I hope y'all ready to hear. The name of my piece is called Even As We Are Going Through a Pandemic. Even as we are going through a pandemic, there are white supremacists who don't seem too timid to let you know that they are livid with your presence. Ahmaud Arbery. Even as we are going through a pandemic, the cells of a deadly virus have procreated while degrading our every vision, has neglected and rejected our normal, has shaken, broken, and torn our spirits. Even as we are going through a pandemic, the government still lets us know they have a chokehold on our life sentence, injustice in the justice system, and strong Black men are still being hunted as if it is a spiritual, traditional ritual. Approximately 6,000 people and counting have tested positive for COVID-19 in the DC area. Hasn't it begun to put some fear in you? So social distancing is for our better and not a social experiment to test your mentality and how well you've been able to discipline your own reality. Lack of respect for our president has caused the Black community to disregard every piece of information from a higher up and scream irrelevance because the government was never made for us, only has oppressed us and pressured us into social alienation. So shouldn't we be equal with COVID-19? Hasn't the Black community always been the egregious virus to get away from? Haven't we always been the abysmal plague that has caused others to cover up and avoid us in social space? Hasn't our culture always been the sickness in your mind that you wanted to hide from your child? What is the feasibility of me already being a part of the 13% that was created as a virus at the expense of an omnipotent white man? You would think going through a pandemic will bolster the healthcare and housing in low-income communities. Instead, it's caused they block proper healthcare off the clock, and if you aren't in grave pain, you should not step into that ER. That is a financial pain you'll be paying for the rest of your life. So Vicks Vapor Rub and Ginger Ale will have to serve you right, and you still might meet your maker through the night. In a country where we are a minority, it makes no sense that a majority of us have contracted such a virus. But even as we are going through a pandemic, we must continue to love ourselves and allow ourselves to heal. We must not allow our brains to become malleable to social change around us. We must continue to grow and prosper, even as we are going through a pandemic. Thank you.
Oh, wow. Thank you so much, Damoni. That was so well done. I am in awe of your way with words and your confidence. Thank you so much. And you talk about really, current things there from, the social inequities and all that, something that you're going to discuss tomorrow. But before I let you go, let me just ask you one thing. When you sit down with your fellow teenagers or, when you have discussions on WhatsApp or whatever groups you have, especially during this time, during this COVID pandemic time, what do you guys feel you need the most? Is it information? Is it to be included in decision making? Or what do you think you're missing out as teenagers, as youth?
I think being a teenager going through this, we want information and we want to feel included because we are the next people that are going to have to take action in the world. So we need to be informed as well as included because our opinions matter too. Even though we are younger, we are still coming up. We are soon to be adults very soon. So we want to be informed. We don't want to go in the world being ignorant and not knowing certain things because it was held back from us because of our age. We want to be well informed just like everybody else.
Wow, that's beautiful. Thank you so much. I would have asked you a second question, but I will definitely catch up with you later in some other forum. I really thank you so much for joining us once again.
Thank you.
Ladies and gentlemen, we are coming to the end of the first day of the Lives in the Balance Summit. And I think that was a really, really good place to, have a youth, have a teenager, just tell us through poetry what is happening to them during this pandemic. And I need to remind you once again that this summit is anchored on 3 key themes: reflect, share, collaborate, and act. We have covered reflect, we have covered share. And I must admit, and I firmly believe that, what I'm feeling, that it applies to you, that joining this summit is one of the best decisions that I have made during this lockdown period. I am so happy, I am so energized and challenged at the same time. I feel like I am here not only for myself, but for all the women in my community, in my society, in my country. Because, these conversations are not just going to end there. We're just finishing day 1, but this is just lighting a fire in me, and I believe it's in all of you, that tomorrow we are coming back with so much fire that even as we break, and whether it's afternoon, whether it's evening where you are, that we are going to pause and just reflect on the discussions we have already had here, and reflect on what your response has been as an individual to the needs and the well-being of women, children, and adolescents, what our response has been collectively, and to think about what your take home is from all that has been shared. And even as we prepare to, commit tomorrow and every day going forward, because it's not going to end with this 2-day summit, to collaborate and act collectively to advance the health and well-being of women, children, and adolescents. Now, I don't want to dilute everything that we've witnessed. Sorry, I'm getting emotional because these are things that are really, really close to my heart. And it gives me so much hope to see all of you discussing this, to see all your chats, to see your participation in the polls. So allow me to hand over to David, who will introduce our last poll of the day and send us into the networking. So thank you so, so much, everyone. And see you all tomorrow. Over to you, David.
Mercy, thank you. Germani, I need to tell you, while this is going on, my team and a lot beyond my team, we're communicating via WhatsApp to make sure that we're coordinated. And pretty much every person was typing during yours to each other and into the chat. Chills, just really super powerful. Such courage. Thank you so much. To have you close us out just feels extremely appropriate. And I love that we have Nairobi talking to DC, talking all over the globe. And you remember the map we showed at the beginning of the folks who've decided to spend your time having these discussions. We're extremely grateful and we're honored, really honored to be able to help to convene this. We want to encourage you to come back tomorrow. We want to encourage you to tell your colleagues, tell your friends, have a look at the agenda. We start the same time as today. And we would love to have, it runs exactly the same hours, but look at that agenda and please come here right at the beginning if you can and join us. We would love to have you. There's so much good stuff that goes on tomorrow. I wanted to do one more poll just because it's kind of early, 9:30 in the morning here. And I know all of us are kind of need our mental health. So many of us have figured out stuff to cope with, help us cope with the pandemic, watching movies or TV, eating pies, cakes, breads, or sweets, enjoying wine, beer, or other adult beverages, spending time with family and friends, focusing on a new hobby, and taking more naps. If you want to weigh in on this poll, you can click the poll link. Okay, looks like a lot of people watching movie, a lot of family and friends. And I'll be interested to see the chat. Please type your answer into chat if you've got something new. Also, if you're focusing on a new hobby, it's always interesting to see what those hobbies are. We find ourselves in different relationships with our family and with our hobbies and with our time, and certainly with our focus. Again, it's amazing we can all come together, and it's really valuable time. Thank you so much for spending it. So the last thing I'll say is, before I release you, is to say, if you want to go and have some discussions, we encourage you to do that in networking. And these are just meet a few people from around the globe. You can stay for as long or short as you want. We'll have the room open for 30 minutes. If you scroll down the website, you'll see that we've got 9 rooms. Room 8 is in French. Room 9 is in Spanish. Room 5 is social protection, and it includes ISL, International Sign Language, for deaf and hard of hearing. But if you're interested in quality of care, violence against, prevention of violence, WASH, any of these topics, if they're interested to you, we encourage you to go in, drop in, maybe meet a few people before you finish your session. We'll do the same thing tomorrow with the same groups, and we'll just give you a chance to meet some folks. So again, we're going to sign off here. We loved having you, and I think we're good to go, and we'll hope to see you tomorrow. Enjoy your networking, and see you tomorrow. Bye-bye.